Welcome to VetNova Care. Today we are presenting a clinical case of upward patellar fixation in a cow that has been suffering for the past 6 months. This condition caused repeated locking of the hind limb and severe difficulty in walking. Before surgery, the cow was unable to flex the affected hind limb properly. The limb remained extended due to locking of the patella over the medial trochlear ridge. As a result, the animal showed stiffness, dragging of the leg, difficulty in standing, and progressive muscle wasting due to chronic disuse. This condition persisted for 6 months, significantly affecting mobility and productivity. Initially, we planned to perform the surgery in standing position using proper restraint. However, during preparation the cow became highly aggressive and restless, making the procedure unsafe in standing posture. For the safety of both the animal and the surgical team, we decided to shift to the second method, performing the procedure in lateral recumbency. The cow was carefully laid down on the ground and properly restrained. The affected limb was extended and positioned for clear surgical access to the medial aspect of the stifle joint. This approach provided better control and safer handling. Step 1. Identification of landmarks. The medial patellar ligament was identified by palpation. The ligament lies between the middle and medial patellar ligaments, extending from the patella to the tibial tuberosity. Accurate identification of the medial patellar ligament is critical to avoid damaging surrounding structures. Step 2. Local anesthesia. Local anesthesia was administered at the surgical site using a ring block or line infiltration technique. This ensures the animal remains comfortable and pain-free during the procedure. General anesthesia is usually not required in adult cattle for this surgery. Step 3. Surgical site preparation. The surgical area was shaved properly. The site was thoroughly disinfected using povidone iodine or chlorhexidine solution to maintain aseptic conditions and prevent postoperative infection. Sterile instruments and gloves were used. Step 4. Incision and ligament separation. A small stab incision was made over the medial patellar ligament using a sterile scalpel blade. Care was taken to isolate and confirm the ligament before cutting. The medial patellar ligament was then carefully transected. This procedure is known as medial patellar desmotomy. Once the ligament was separated, the patella was released from the trochlear ridge, eliminating the locking mechanism. Step 5. Closure and dressing. Since this is a minimal incision procedure, suturing may not always be required. The wound was cleaned and dressed appropriately. Post-operative antiseptic dressing was applied. Post-operative care included broad-spectrum antibiotics for 5 days, anti-inflammatory drugs for pain management, restricted movement for a few days, clean, dry housing. Regular monitoring ensured proper recovery. After surgery, the cow regained normal gait. The locking of the patella was completely resolved. The animal was able to stand, walk, and bear weight without difficulty. This case demonstrates that medial patellar desmotomy is an effective and simple surgical solution for chronic upward patellar fixation. Immediately after the procedure, the limb was flexed and extended manually to confirm proper release. The locking was resolved successfully. The cow was assisted to stand and normal limb movement was restored. Early diagnosis and timely surgical intervention are essential to prevent long-term complications. With proper technique and postoperative care, recovery is usually rapid and successful. Immediately after the surgery, the cow was able to stand without assistance. The locking of the hind limb was completely resolved at once. Normal flexion and extension of the joint were restored instantly. The improvement was clearly visible. The cow started walking normally and the abnormal stiffness disappeared. This dramatic change felt almost like a magic surgery, but in reality, it was the result of correct diagnosis and precise surgical technique. The owners were extremely satisfied to see such immediate recovery after 6 months of suffering. This case proves that medial patellar desmotomy is a simple yet highly effective procedure when performed properly. At VetNova Care, we are committed to providing practical veterinary knowledge, real clinical cases, and surgical procedures to help farmers, veterinary students, If you found this case helpful, please support our work by subscribing to the channel. Your subscription motivates us to create more educational and field-based veterinary content.